So many people hear the words clinical trial and they assume it's a last resort. But today's clinical trials can be an option much earlier in a patient's journey. Joining me now is Dr. Justin Call with Utah Cancer Specialists and in partnership with the START Center for Cancer Research, and also a patient, Katrina, who is here to share her personal experience. Welcome to both of you. Thank you for being here.
Thank you.
Thank you for having us.
I said during the commercial break, I'm so glad we're addressing this particular facet, of the topic under trial research, because there are so many preconceived ideas or notions around it. And Dr. Call, when people hear those words, clinical trial, they might automatically discount it, like think it's not for me, it's not accessible, it's not attainable. What would you say to that patient?
Yeah, well, first, I think it's important to know what clinical trials are, and they're studies of promising new cancer treatments that are really an essential part of cancer care, and they allow patients access to the latest therapies, but also help improve future cancer drugs as well.
So we could talk about this for hours on end, but can you boil it down to one thing that you would want someone to know maybe before they considered a clinical trial?
Yeah, so one of the biggest misconceptions that I hear is that clinical trials are a last resort. And in reality, many of these studies are options much earlier. Again, they offer patients access to these promising treatments that may eventually become FDA approved, but can get access to them sometimes even years before.
When I also told you I'm grateful for a doctor who has his toes on the edge or her toes on the edge and looking forward for those options. Am I clear in understanding that a clinical trial doesn't mean you discount your standard care, like they go hand in hand?
They do go hand in hand. Clinical trials have eligibility criteria, and sometimes the criteria kind of mandate that people get a standard treatment first that's FDA approved, and then a clinical trial option can be considered after that.
Katrina, can you tell us from your perspective as the patient, when did you decide to consider a clinical trial?
Yes, so I was diagnosed with stage 4 breast cancer in 2022, and I went through chemotherapy, and then I went through 2 oral medications. And unfortunately, after a while, I would say about 2 years, my cancer had progressed slightly in the liver. And then my primary oncologist said, hey, there's a new clinical trial. Are you interested in trying that before we continue on with the standard care? And I said, yes, let's go with that. So I was hooked up with Dr. Call, and then I've been on it for quite some time, over a year and a half now. And I'm starting a second new clinical trial currently.
Are you naturally an open-minded person? Was that, I mean, it's easy in certain positions, I think, to say yes, but what would you say to someone else maybe considering?
Yes, I think it's actually a really good option to have in their toolkit as another option to try. Clinical trials are not as dangerous as a lot of people say. It's very, very safe for a lot of them, and they're on top of it to make sure you're doing well, any kind of reported side effects, and they're really open to exactly what to expect from these things.
Well, thank you for that firsthand experience, and best of luck to you in your care and your recovery and progression. Dr. Call, where can we go if you want to find more details?
So you can go to our websites, either utahcancer.com or startresearch.com. And one last thing I'd like to say, I think it is important. We want to encourage patients to ask their oncologist about clinical trial options. Sometimes oncologists bring it up, but sometimes it always helps if the patient is interested in knowing those options as well.
That lean-in energy I hear you saying is appreciated on your end. Well, we appreciate both of you. Excellent information. Thank you so much.
Thank you.
Thank you.